action, let's go. trouble 찾으러.
The coronavirus, or commonly called Covid-19, is a virus that causes upper respiratory tract infections. COVID symptoms can range from mild to moderate, like the flu. Many people are infected with this virus at least once in their life. Previously, several types of coronaviruses that could also cause disease were Middle East Respiratory Syndrome, or MERS-CoV, Severe Acute Respiratory Syndrome, or SARS-CoV, and pneumonia. SARS, which appeared in November 2002 in China, spread to several other countries, starting from Hong Kong, Vietnam, Singapore, Indonesia, Malaysia, England, Italy, Sweden, Switzerland, Russia to the United States. The SARS epidemic that ended in mid-2003 infected 8,098 people in various countries. At least around 774 people lost their life due to this serious respiratory tract infection. To date, there are 7 types of coronaviruses HCOVs identified, namely HCOV 229E, HCOV OC43, HCOV NL63, HCOV HKU1, SARS-CoV, which causes acute respiratory syndrome, and MERS-CoV, Middle East Respiratory Syndrome. At the end of 2019, a new type of coronavirus emerged, which is now called novel coronavirus SARS-CoV-2 or COVID-19. This virus first broke out in the city of Wuhan, China, and spread to other countries starting in January 2020. Meanwhile, Indonesia announced a case of COVID-19 in March 2020.
COVID-19, also called coronavirus disease 2019, is a sickness caused by a virus called Severe Acute Respiratory Syndrome coronavirus 2, or SARS-CoV-2. This virus is a coronavirus. Coronavirus is a family of viruses that can cause illnesses such as the common cold, Severe Acute Respiratory Syndrome or SARS, and Middle East Respiratory Syndrome or MERS. Many people with COVID-19 have mild to moderate symptoms and can recover on their own, but COVID-19 can serious illness and lead to death in some people. People at higher risk include older adults, and the risk increases with age. Also, at higher risk for serious illness are people with existing medical conditions. Older people and those with underlying medical conditions like cardiovascular disease, diabetes, chronic respiratory disease, or cancer are more likely to develop a serious illness. Anyone can get sick with COVID-19 and become seriously ill or die at any age. Cases of novel coronavirus (nCoV) were first detected in China in December 2019, with the virus spreading rapidly to other countries across the world. This led the World Health Organization to declare a public health emergency of international concern, or PHEIC, on the 30th of January 2020 and to characterize the outbreak as a pandemic on the 11th of March 2020.
Cause. In most cases, coronavirus only cause mid to moderate respiratory infection, such as the flu. There are allegations that the coronavirus was originally transmitted from animal to humans. However, it was later discovered that the coronavirus was also transmitted from human to human. A person can contract coronavirus in 4 ways, namely, number 1, accidentally inhaling droplets that come out when a COVID-19 sufferer coughs or sneezes. Number 2, holding your mouth or nose without washing your hands first after touching objects that have been exposed. The droplet from COVID-19 sufferers, for example, monitor, knockboard, or table surface. Number 3. Have close contact with COVID-19 sufferers.
COVID-19 is caused by the SARS-CoV-2 virus, which is spread through droplets, contact, and airborne transmission. It may spread through droplets. This is possible if the spit or saliva or an infected person lands on a person within 2 meters. Contact: if a person touches a surface with infectious secretion such as a door handle or table and touches their eyes, nose, or mouth, they may be infected. Air: small, fine droplets can remain suspended in the air for up to 3 hours. Therefore, the risk of transmission would be greatest within 2 meters of an infected person. Where the concentration is greatest, this risk decreases with distance. Airborne exposure is also affected by factors such as airflow, temperature, humidity, and exposure to sunlight.
A coronavirus infection typically manifests as three common symptoms: fever, coughing, flu, sore throat, dyspnea, shortness of breath, and feeling weak. Additional symptoms that an infected person may have include diarrhea, feeling nauseous, headache, and loss of taste and smell. Following the above-mentioned early symptoms, these symptoms will either disappear or worsen. Severe symptoms of COVID-19 might include high fever, coughing, a blood, and chest pain.
Symptoms based on research that has been carried out. The following are the symptoms that COVID-19 patients often experience: 1. Fever or chills. 2. Chokes. 3. Difficulty breathing or shortness of breath. 4. Anosmia. Loss of ability to taste and smell. 5. Sore throats. 6. Cold or blocked nose. 7. Fatigue. 8. Muscle or body aches. 9. Head change. 10. Nausea or vomiting. 11. Diarrhea.
The treatment for coronavirus or COVID-19, there is no truly effective drug to treatment coronavirus infection or COVID-19. Treatment option will be adjusted to the patient's condition and its severity. Some patients with mild or no symptoms will be advised to carry out an independent isolation protocol at home while still taking steps to prevent the spread of coronavirus infection. Apart from that, doctor can also provide several steps to relieve symptoms and prevent the spread of the coronavirus, namely referring serious COVID-19 sufferer to undergo treatment and quarantine at a referral hospital, and then providing fever and pain relief medicine that is safe the appropriate to the patient's condition, encourage COVID-19 sufferers to self-isolation and get enough rest. Encourage COVID-19 sufferers to drink also of water to maintain body fluid levels.
Here I will explain how to treat COVID-19. Coronavirus treatment for patients with mild or no symptoms. The doctor will recommend self-isolation at home while still taking steps to prevent the spread of coronavirus infection. Some action that a doctor can take are: prescribe fever and pain relievers that are safe and appropriate to the patient condition, encourage patient to self-isolate and get enough rest, encourage patient to drink lots of water to maintain body fluid levels. Antibiotics are not effective in infection against virus, therefore, the use of antibiotics to prevent or treat coronavirus infection is not recommended. Meanwhile, for patients with severe symptoms, the doctor will provide a referral to undergo quarantine at a referral hospital. Treatment methods that can be given include giving intravenous fluid to stay hydrated, installation of a ventilator or breathing apparatus, administering medication such as anti-inflammatory drugs and drugs to prevent blood clots, several types of antivirals, namely favipiravir, molnupiravir, and remdesivir, have been studied to fight the coronavirus. However, to date, research results show that antiviral drugs are not effective in treating COVID-19 and are not effective in reducing death rates.
To prevent COVID-19, it is recommended to follow several measures based on guidance from the World Health Organization, the Center of Disease Control and Prevention, and other health authorities. Number 1 is vaccination. Get vaccinated as soon as it's your turn and follow local guidance on vaccination. Number 2 is hygiene. Regularly and thoroughly clean your hand with an alcohol-based hand rub or soap and water. Wash your hands before eating and after being in public place. Number 2 is physical distancing. Keep a physical distance of at least 1 meter from others, even if they don't appear to be sick. Avoid close contact with anyone who is sick or has symptoms. Number 4 is wearing mask. Wear a properly fitted mask when physical distancing is not possible and in poorly ventilated areas. Avoid using or sharing items that are reusable such as menus and wash your hands before eating. Number 5 is avoiding contact. Avoiding contact with people who have COVID-19, whether or not they feel sick, can reduce the risk of catching the virus from them. And the last is ventilation. Improve ventilation in indoor space to reduce the risks of transmission.
Prevention. 1. Using a mask. 2. Washing hands regularly. 3. Stay away from crowds. 4. Clean your device regularly. 5. Clean the home environment. 6. Getting the COVID-19 vaccines. 7. Increase body endurance.
Find your 트레저와 함께 달려 Ready for action, let's go 트러블 물을 찾으러